Hello everybody, I am Dr. Amol Akhade. I am Medical and Precision Oncologist at Fortis Cancer Institute, Fortis, Mumbai. Today I am going to talk to you about a very important topic that not only cancer patients, their relatives, but overall common population also like to know. That is diet and cancer. Everybody wants to know what diet they can have to prevent cancer, and unfortunately if they have cancer, after having this deadly disease, what diet they can take. So I will start with the second part first. That means if you are having cancer and you are on treatment, is there any dietary restrictions? So my advice to my patient is very simple. Whatever that is homemade, properly boiled and cooked can be taken. What it means, you can have a good vegetarian food made at home. You can have a good non-vegetarian food also made at home, provided it is properly boiled and cooked. That's the first thing. Second thing, can we take raw vegetables or raw fruits? Yes, you can, provided you peel off the skin. Why? Because we don't want any germs to go inside, so you need to peel off the skin. You can have any fruits. Yes, you can have fruits provided they are properly washed, and then you can have them. What about non-vegetarian food? As I said, egg is the best source of proteins, and hence those who are having this particular treatment, especially chemotherapy, I recommend to have eggs so that you get maximum protein. What are the other sources of proteins that you can have? You can have nachni, ragi, you can have pulses, you can have dal. So anything that contains good amount of protein should be taken. One more important source is of course soybean. Now a lot of products of soybean are available in the form of soybean cubicles, soybean powder, and you can utilize these to enhance the protein level and hence immunity of the body. Now the other question people ask, should we take sugar? Now this is a very common myth. That means people feel that if you are having cancer, cancer cells get fed by sugar, so you should cut down sugar. This is not correct. There is no scientific basis to this. What I suggest my patient, that anything that is in excess is bad. So sugar in excess is bad, but normal amount of sugar intake is allowed. There is no way that you can control your cancer by stopping the sugar intake, and there is no scientific basis for that. Now some people ask, should we have hot beverages like tea, coffee? Answer is yes, you can very much have it. Now another common question people ask is, what about red meat? Yes, red meat is one of the known moderately carcinogenic substance, and if possible that should be avoided. But what about fish? No, fish you can have because that has very good proteins and that is good for your overall health, especially if you are on treatment. Now the next question is, can I have some diet to prevent occurrence of cancer? Please let me tell you, there is no such super food which if you eat will prevent the cancer. But yes, all the good natural resources like fruits, vegetables, pulses, and moderate amount of meat, all these are good for your body and you should take them. Try to avoid, of course, pesticide contaminated food. Try to have as much as organic food if possible. These are the basic precautions we should take. I hope this advice is helpful to cancer patients, to caretakers, and in common public in general. Thank you very much.